So as we're going to discuss each protocol, the person who wrote the protocol will spend, I'll show it up on the screen, and you could spend about 5 minutes talking about the protocol. And if anybody has any questions, they could ask some questions, but then afterwards we'll talk about the protocol, and we'll rate the protocol in terms of its relevance. How relevant is it to, investigating an issue in research ethics? Is it doable, feasible? How novel is it? Has it been, something that's been done a million times already? Is it ethical? What type of resources are needed? And is it timely? It's almost like a SMART type of assessment, and this way, when you assess the protocol this way, we'll have an idea on whether it's something to continue. All right, or maybe one should stop and think, and maybe think about something else, which is fine. I mean, this is what happens when one starts out with a research project. Is this the best project, or maybe should do something else? Also, as we look at these proposals, again, if people want to join up together and do these projects together, I encourage that. There's usually not, sometimes not very collaborative and working alone. So I encourage working together, okay? All right, so having said that, where is the, I think it's in here. All right, who wants to discuss first?
Okay, I can start.
Okay. And Maha write down in the chat that she doesn't have good connection. She will be just chatting. She will turn off the video.
All right, do you all see the protocol?
Yes.
Okay. All right, Sarah, go ahead, tell us about it.
It's about knowledge, attitudes, and perceptions of pediatric patients and their families towards service provision in oncology settings during the COVID-19 era. Shall I just read the background?
No, I mean, don't read it. Just summarize it.
Okay.
How's that?
Okay, during the past few months, we faced a lot of problems. I work as a lecturer of pediatric oncology. So in our center, in the past few months, we faced a lot of problems in the oncology settings because of the COVID-19 issue. We have patients from all over the country. We had problems in transportations. Patients are anxious, they fear the virus. So we had a lot of issues from people not complying to treatment or anything like this. So I wanted to talk about it and how can we manage this during. It's something like a crisis management or disaster management. We didn't have a plan, but we managed to put a plan. So I wanted to talk about this. I wanted to talk how do patients and their families perceive all these issues in order to improve the service at times like this.
Okay. So your objectives are what?
To assess the knowledge, attitudes, and perceptions of oncology patients, the patients and their families. We are so patient, we have young patients. I took the age from 6 to 18 years. I included in the objective the patients and also their families, not only the patients, their knowledge, attitude, and perceptions towards the healthcare service provided during this era.
So you're going to do oncology patients and their families. Okay. All right. And what else are you going to do?
I put design. I'm not sure, of course, of many things about it, about the sample size. I just put this number.
What is a simple random
Can you hear
sample?
me?
What's a simple random sample?
Taking patients and their families randomly from those attending the clinic.
Well, Sam, is that, so how would you?
I think Professor Henry is disconnected now.
Yeah, I think so. I think we lost him. Finally, once we have internet issues in the US, not just our countries.
Is Dr. Tanner okay?
I don't know. On Friday, Professor Henry said he messaged him and said he's not, he is diagnosed maybe, but he's resting at home, but he cannot attend for virtual training.
Yeah, I hope he's fine.
Yeah. Can we discuss it until he connects or?
Okay. I don't know if I have it here. You can see it as I don't have it here.
Okay, it's 200 participants. You mean 6 to 18, and you will ask for assent?
Actually, I did. I don't know. I have many issues to ask about. By the way, I was not sure what to do about the consent. About the sample size, I didn't calculate it. I just speculated the number and put 200. I didn't calculate anything. So I have many questions actually.
I know. Yeah, I remember I also emailed him 2 weeks ago when he sent out last year's proposal asking how we can calculate sample size and everything. And he said, don't think about sample size and these minor issues now, because we don't need that. We just need objectives, aims, and methodology.
Yeah. Same also about the statistical analysis. I didn't know what to do to write about the qualitative research.
Yes,
analysis.
I think none of us are sure about that. No.
Yeah, to tell me, Sarah, so how are you gonna convince the students to participate in your experiment?
The patients, not the students.
Yeah, patients.
Patients, students, participants. How are you gonna convince them?
I think no problem. So patients are willing to participate. It's just the consent, and it's just a questionnaire. And
Yeah, so I needed to know, like, your patient is like minors, right?
Yeah.
So are you gonna get, like, you know, like?
Do you think we should have from the patient?
I can't hear you. We should have what?
Assent from the patient and consent from their legal
their legal guardian or their parents, right?
Yeah.
Yeah, so do you think that...
Most of the time, that's what we do.
Yeah, but what if they refuse to participate in the experiment?
No problem. They can refuse, no problem at all. They are also receiving the standard of care, no problem.
I think all the patients are happy to talk and respond and reflect on services they get with their treatment.
Yeah,
but it
I think
depends.
so.
Yeah, but it depends on.
It's going to be stated in the informed consent if they refuse to participate. They are offered the same service, the standard of care. They are not declined any service because they refuse to participate.
So,
Gulana, can you share the protocol, the proposal?
Yeah.
You are the host.
Okay, I will.
Or maybe Sarah, you can share it.
No, I can.
I actually don't have it here.
I can share it. That's fine. No worries. I can.
So Sarah, how would you perceive the attitude of the children? You said you will involve the children and their families, right?
Now you are asking about details of the study tool. This is the first step.
Okay.
Can you see my screen?
Yes.
Yeah.
Okay, and who is gonna interview them? Is it just you, or you will have some people, because the number of people for 1 month is very little. So how many people are gonna help you? Are there only one PI or anyone in your research team, or do you take them in a specific room?
I think it would be better to have a research team. The study tool is going to include interviews, personal interview, and questionnaire, written questionnaire. So I think for the interviews, we can have a research team, maybe six interviewers.
Okay.
Do you think it's better for the interviewer to be the physician in contact with the patient, or it's better to be someone outside someone who does not provide the care?
Yeah, it's usually someone who is not actually someone who is directly providing the care, because maybe you are not telling your true opinion in front of your doctor, you know?
Yeah, you're right, yeah. And who should be like social work?
Someone in your research team who is totally aware of the research, but of course one person cannot do all, because I'm sure in one day there are many patients in the hospital. So if you want to take each patient one day, or just one patient per day, it takes more than 1 month. Maybe it takes longer.
Yeah.
So maybe you have a research team, you just give them all the information, make sure they know what they are doing. Maybe 5, 6, I don't know, it depends on your exact number of participants. And you should know, the longer the questionnaire, the longer time it takes. Do you have the questions for interviews, or you just ask about their here you just said you want to check their attitudes and perceptions?
Yeah.
Can I ask a question?
Yes, please.
Yes, I just want to know what services are you providing now, which is different from before in the hospital?
That we are cutting down the numbers we receive in each clinic. For example, we decreased the sessions of chemotherapy we have. Another issue that we decreased the number of patients like survivors. We used to see survivor patients, for example, every 3 months. No, we made the visits further, like every 6 months. So we cut down, so we can cut down the numbers available in the clinic. That's one point in the oncology.
So you did not introduce any new form of service as a result of this COVID-19. It's just the same service, but you just reduce or change the modalities.
We have also one example also that we developed a WhatsApp group to be in contact with the patients in order to decrease their comings to the hospital for anything to ask about some investigations, anything to decrease how many times they come to hospital. That's also another thing.
So I'm back.
Welcome back.
I was having problems with my internet. Thanks for staying. And so anyway, so let's.
Do you want me to stop sharing this screen? We are looking at Sarah's case, Sarah's proposal.
Okay. Why don't? Oh, wait a second. I think. I have to. Are you seeing my screen now, or am I looking at your screen?
No, Golana's screen.
Oh, okay. Well,
I can stop sharing.
Actually, who's sharing the screen? Golana, you are?
Yes.
Well, Sarah, do you want to share your screen and you go over the protocol? How's that?
Okay, I just will have to get it here.
Okay, I stopped sharing, Sarah.
Yeah. Okay. So why don't we do it this way? Why don't we just getting right? Oh, I see. So why don't you just finish reviewing your protocol, and then we'll all ask questions. How's that? So I'll wait until you get your protocol back up.
I'm just trying to get the file because I'm using another computer. If someone,
okay. Well, let me bring it up then. No problem. All right. So here it is. All right. So okay, sampling method, ethical considerations. So data collection. So what kind of data are you going to collect?
The study tool will include personal interviews and questionnaires. I don't have what's going to be written in the questionnaires or what are the questions. I have not thought about it really.
So when you say personal interviews and questionnaires, what do you mean?
Two tools, one face-to-face interview with a social worker or researcher, and the other tool is questionnaire, written questionnaire to be filled.
So you're going to do quantitative and qualitative?
Isn't this both qualitative in the questionnaire? Isn't this qualitative?
Okay, so all right,
So.
let's so if you're going to use a questionnaire, ask questions and yeah, let me see if I could bring up an example, because let's this I'm sensing some confusion here on interviews and questionnaires. So here's a questionnaire we're using for members of Research Ethics Committee regarding biobanking research. So we have these questions, all right, and then we ask about current practices. You know, we ask very important, no opinion, slightly important, right? And then we ask about current practice, and then we ask them about certain attitudes they might have, all right? And they have to respond in what we call a like it response: strongly agree, agree, no opinion, disagree, strongly disagree, okay? And usually these questionnaires, they're close-ended. You give one response to each question, and usually with investigators and other people, members of ethics committee, we send them a link to the survey and we call it self-administered. They fill it out themselves.
Yeah.
Okay. Now, usually when we do questionnaires with patients or the members of the public, they may need some help understanding what the question is asking for, and therefore we have a person, usually called a data collector, who goes over each question with the with the participant to make sure they understand the question, and then they give a response. Now, unfortunately, sometimes people call that an interview. That's not an interview. Yeah. You're still using a questionnaire, but you have a person who's sitting with the other person to make sure they understand the question. Okay? Yeah. Now, as I said before, unfortunately, some people call that interviews. Like in the domestic violence protocol we looked at on Friday, it talked about interviews. I'm thinking they had a questionnaire and they sat with the wives and helped them complete the questionnaire. Now,
that's not a proper interview. The interview is not like this.
That's right. So that's still a quantitative research. Now, a
why is it quantitative? Because of the Likert scale, or because of what?
Well, because you're getting quantitative data.
If he chooses from this if he chooses, for example, A or B or C from the multiple choices,
it's quantitative in the sense that once you have all the responses, okay, you could quantify the answers in terms of how many people said strongly agree. You could count it up, okay, and you could then compare it between gender, between education degree. You could quantify the responses, okay? And now one could say, well, this is a qualitative answer. Well, you could, but that's incorrect. You're quantifying the responses, okay? Yeah. Now, as opposed to qualitative, so I ask people open-ended questions. How do you feel about genetic research? And then people give me a long answer. Okay. And they may say one thing or another. Another person may say something else. Okay. And it may be totally different. And you can't quantify. I mean, let's say if you do 20 interviews like that, okay, you know, maybe 4 people will say the same thing, okay, and maybe 5 people will say something else, and 2 other people will say something else. Now, I mean, you could quantify. You could say 4 people said this, 6 people said this, but yeah, it's not the same thing as in a qualitative research. Your purpose is not to quantify the responses. Your purpose is to explore the responses, because you really don't know what people might be thinking about. Okay. All right. So
qualitative variable doesn't mean qualitative research. It's only the variables that is qualitative, but the statistics or the analysis is quantitative. Right. Yeah,
that's right. So I mean, you're saying, yeah, look, data will be organized, blah blah blah, and well, analysis.
When I got to the analysis part, I didn't. Yeah, I didn't know what to write in the analysis data. I thought
no. That's fine for now. So when you say personal interviews and questionnaires, I'm thinking that you're going to have people sit with the family members to help them complete a quantifiable questionnaire. Is that correct? Is that your concept?
Yeah, that's what I thought about at first, but that's what I'm thinking now.
Right, and because an interview study takes several months. Okay, great. All right, good. Any questions from other people about this protocol?
Yeah, we were just talking about the consent and the assent. About group, the patients are 6 to 18 years. What shall we do about this?
Okay, comments from other people? You want to help Sarah out?
Yeah, we discussed earlier that she asks for assent and informed consent from the parents.
Okay. All right. Are you going to get assent from a 6-year-old?
Not for 6-year-old, but maybe like 8 to 10, and then categorizing assent based on their age.
Right. Yeah. Well, I mean, usually the amount of information you put in an assent form will be different for different age ranges. Yes. So like someone like 8 to 10, you'll put in small amount of information. 16 to 18, you'll put in much more information. Okay. All right. Very good. So, all right. So let's review this protocol. So what do we think about this protocol? Relevance.
To me, it's relevant. The topic is very relevant.
Yes.
What's that?
The topic is relevant. Relevant, yes.
So for what?
Yeah, because when you look at currently we're in the pandemic, and then that's our specialty area, because he feels that there is a gap in the services which he wants to document. So to me, it's very relevant.
Okay, other comments?
I think it's relevant to the time of COVID pandemic and to the specialty where Sarah works.
Okay.
For the feasibility, I just wanted to clarify.
No. Before we get this.
For the relevance. Okay.
Feasibility. Sarah, what program are you in?
What do you mean?
The Moretti program.
Middle East Research Ethics Training Initiative.
Okay. So
what's this?
For me, I didn't get the same point, by the way.
What's that?
While I didn't get that it should be related to the research ethics. For me, neither. I thought that it's going to, like the presentation, we are going to evaluate the method of writing, the analysis of the data, and not to be relevant to the course, actually. So I'll have the same comment.
It's what could I say, Sarah? It sounds like a very relevant program, a research for the times we live in, but this is not a COVID program. It's not an oncology program. We're trying to advance knowledge in research ethics.
Okay.
So this is almost like evaluating protocols. The first thing we look at is social value, in the sense that how relevant is the protocol to advancing health. Here, the protocol is it asking an important question about research ethics?
Okay.
Okay, so how could we I guess the question is, see, part of this form is, what is your research problem? You know, when Rahab started talking about how do you develop, you know, a research question, and so the first question you ask is, what problem do you want to investigate in your field? And so I'm not expecting an answer now. So the question might be, what are there any problems you want to investigate in oncology related to you know, research ethics, so just, you know, you may want to continue to think about that, or you may want to see what the other protocols look like, or you know, like in oncology, like I showed you that previous questionnaire about you know, biobanking research.
Yeah.
You know, what are the ethical issues in biobanking research, or what are the ethical issues in doing oncology research? Okay. And an example, I don't think I don't know if it's, I don't know how much research. I mean, I know there's research in oncology. I don't know how much. So, like, for example, someone asked me to review her paper on, we have this thing called ECMO, extracorporeal membrane oxygenation, in which we're putting a lot of COVID patients on. It's supposed to act, you know, when the lungs fail, it's almost like cardiac bypass. And she was writing about asking patients to enter research protocols when they get put on ECMO. And I said, well, this is similar to oncology research. Like in my hospital, all oncology protocols are research protocols. So every time we give chemotherapy to patients, we ask them to enter a research protocol. And so that brings up a whole lot of issues as well. So, you know, so there are, what I'm trying to say is there are a lot of ethics issues in research, in oncology research. Okay. So you may want to think about that. Okay. Actually, we had a person a couple of years ago who was from the King Hussein Cancer Center in Jordan, and she did some questionnaires about just that, about patients entering research protocols. One of her questions was the appropriateness of having oncology patients towards the end of their life and enrolling them into research protocols. You know, those are very vulnerable subjects, and is it appropriate to enroll patients who have 6 months to live into research protocols? Okay, that's just another example of a type of oncology problem. So think about if there's something special you want to do in oncology, which would be great, okay? Or, I mean, we have 2 other people from Ain Shams, and we have a lot of other people from Ain Shams. So, you know, just something to think about. But I think in terms of protocol writing, this is a good start. You know, good objective, knowledge, attitude, perception, cross-sectional study. We may need to, when Sama gives her lecture, we'll talk more about what is a random sample. How do you go about getting a random sample? Okay, we'll talk about that, and we'll talk about the study tools and about what type of statistical analysis would you do. What I'm talking about is descriptive research, descriptive analysis, chi-square, logistical regression, blah, 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 all that good stuff that, you know, again, doing research gets us familiar with knowing the different types of analysis. Okay, so this good start for a protocol, but as we saw, you know, not really relevant to research ethics. So this is part of the thinking process. So anyway, all right, good. Questions? All right,
So
good.
I want to ask if this is the protocol, so what should be the research question in such this type of protocols?
Well, what do you mean? What should be the research question? Depends on the research problem.
Or research problem, yeah.
So what do you mean? What should be the problem?
I mean, what is there a hypothesis for this protocol?
Well, yeah, you tell me what would be a hypothesis. Yeah, sure, there is. We don't, Sarah didn't mention the hypothesis. I think that
I mean, can the hypothesis be like, was the oncology clinic at Ain Shams University successful during COVID time? Is this a hypothesis?
No, the hypothesis is, so I think it would be a good idea for everyone when you write up your proposal to write down what is the problem. These are the steps. First, you ask, okay, I want to do research. What problem exists in my field? What is the problem? Okay, and what that will give you the question: what are the solutions to be considered, and what's the hypothesis? So, so in this protocol, the problem is, you know, service provision in the oncology settings during the COVID area. Okay, that's the problem. You didn't state it, but that was the problem you were attacking. And the question is, do patients get adequate health service? Do oncology patients get adequate health service during the COVID pandemic, right? So we have the problem, the question, and the hypothesis would be, the null hypothesis would be what?
Null hypothesis.
Anybody?
That there was a difference between services provided to oncology patients before and after COVID pandemic?
The null hypothesis.
As we are receiving the service.
What does the null hypothesis mean?
That there is no difference between the two variables we are studying or we are comparing.
Right, yes, there is the null hypothesis, there is no difference. Okay, and if we see a difference at the p level of 0.05, then we reject the null hypothesis. And so now we have to so when you think about it, we have to make some a little changes, because in order to before and after, we're not going to get that information, right? Before and after. I mean, before COVID has gone, okay? We can't get those responses about service provision, okay?
Yeah, right.
So actually, that's something to think about. If if the problem is whether patients are getting adequate service, okay, and you want to investigate the hypothesis before and after, this questionnaire study will not answer that question.
Yeah, because we do not have the previous.
That's right.
Yeah.
That's right. So that's why it is so important to state what is the problem you're investigating. Okay, what question do you want to answer? And then what is the best research design? And if that is the problem you're investigating, a questionnaire study is not the way to go about it. I mean, to be honest with you, I don't know what how you would investigate that study, that problem. It's very interesting. I think.
Can I ask a question?
I know I've been reading reports about how people are delaying going to the emergency room, and because of the fear of catching COVID in the hospital. And they're looking at data, they're looking at quantified data about how many patients entered the emergency room before COVID and after COVID. Actually, I was reading an article, where are all the preemies? You know, all the, babies born before maturity. And the neonatal intensive care units are almost empty. And they're looking at the statistics, and they're seeing there's not too many preemies being born. And now they're hypothesizing, well, a lot of pregnant women are staying home, getting a lot of rest, they're not doing shopping, blah, blah, blah. And maybe there's no premature births because of that, okay? So anyway, so this is a good example of the steps one needs to take to investigate the problem. So you really have to sit down and understand what problem you want to investigate. Okay. All right, good. So let's, who's next? This very good discussion. Who wants to be next? We're running out of time, guys.
I think it should be me, because I will face the same problem as Sarah.
Maha.
Who?
Maha.
Who's
Maha.
talking?
Maha.
Maha. Okay, you're going to face the same problem?
Yes.
All right, let's see what. Oh, by the way, do me a favor, guys. When you label your file, get in the habit of putting your name in it. Okay, just saying proposal doesn't help, because actually two people had the same idea. Well, oh yeah, here's another proposal. So anyway, just a small comment. All right, yeah. Maha. Okay. All right, so review your proposal.
So it's the same problem, COVID-19 pandemic we faced all over the world, but I took from other perspective, the educational part, since we are, me and Sarah, lecturers in Ain Shams University. So we faced many problems while putting off all the educational activities, and we shifted, as every institute else everywhere, to online teaching, which was not very common in our university, actually. So we started to give the theoretical parts virtually, and we till now we postponed the clinical part. And then we started to discuss with each other that maybe since the COVID-19 pandemic is going to continue like for 1 year after, then maybe we should develop or improve the educational system virtually, and to put more plans for this improvement and how to solve the issue of clinical partners. Fifth year undergraduate, they have internal medicine and pediatrics. This is a question. Plus, even after the end of this pandemic crisis, what if the virtual educational process was better than the traditional one? What if we can shift from giving lectures, especially the lecture, not the clinical part, all to be virtual, and to spare the energy and the cost of having the students face-to-face to just the clinical part. So I was thinking to get the knowledge, attitude, and practice of the students themselves, and to ask about any problems they face, because some of them were confused, they have internet issues, the materials, is there a difference between the face-to-face discussion they had to have, or it was the same? Maybe they give me like more ideas or more suggestions for improvement of the educational process.
So let me comment. You say knowledge, attitudes, practice.
Yes.
What do you mean by knowledge regarding online teaching? What kind of questions would you, what are you planning to ask about knowledge of online teaching?
So I didn't think of the questions, but maybe I can ask if they had experience before the pandemic part, or they used the online teaching for another course or something.
I'm not so sure what kind of knowledge you're asking.
I mean, some of the students, they have never heard about Zoom or any other programs. So I'd like to know if they knew about it before or not.
Okay, what is the problem you're investigating?
So I didn't think about the problem from the start. I think this was wrong, but I thought that I want to compare the virtual and traditional teaching methods, and I want to ask questions about difficulties, so to put solutions to improve the whole process.
Okay.
I want to, if we're going to ask like Sarah's proposal, maybe I want to ask about the attitude of fifth-year medical students about online teaching. This is not a problem.
Right, that's not the problem.
Yes.
The attitudes is not their problem.
Yes.
So the problem you want to investigate is what was the difficulties faced by the students, blah, blah, blah. What would be actually, do you have any idea what problems they might be facing?
For online teaching?
Yeah.
Yeah, I think I know some problems about internet
some
connection.
Problem. What's that?
The internet connection, this is a major problem we all face here. Some of them complained about lacking the face-to-face interaction.
Okay.
They couldn't get the whole info, or some of them like are lazy to discuss when they are online.
Okay. Do you think there might be problems that you actually don't know about?
I think they can add one.
What's that?
I think I can add one problem. One of the major problems that medicine is practical. The student should see the patient. This is a major defect problem.
Okay, all right. But I guess what I'm getting at, there may be problems with devoting time, because during COVID time, there may be a lot of family problems, issues, okay,
Yes.
right? Women may have problems. I mean, this is more with graduate students, taking care of their children, blah, blah, blah. What I'm getting at is this the best research methodology to answer your question in terms of a questionnaire study? Is that the best research design? What I'm seeing is that there's a rush to doing these KAP questionnaires.
Yeah, I was thinking the same while discussing Sarah's proposal. I didn't start with the problem,
right?
But I feel like I want to get these data. I want to know.
Okay, so what's the best way? What's the best way to get these data? To get what the problems are? What I'm trying to say is that I don't think you know what all the problems might be.
No, of course not.
Okay, so how could you develop a questionnaire if you don't know the questions to ask?
Yeah, so I was thinking like to add open-ended question.
Okay,
what difficulties have you faced, and what is your suggestions to solve? Because many problems I cannot solve alone, but maybe
we're not talking about solving them. The issue is, what are the problems?
Yes.
Okay, and so, right, so you have to be open-ended. And this is a motivation to do qualitative research. You do an interview study, and you sit with them, and you ask open-ended questions, and you let them talk. And you don't want to quantify the problems. You want to know what the problems are. Okay? And so hence, you want to do an exploratory study. And to do an exploratory study, you do an interview study or a focus group study. These are not sensitive questions. So you could actually do a qualitative, a focus group. So here, this is a good example of when you may want to do a qualitative study, because this is all new stuff. I don't know what all the problems might be. Now, having said all that, you're all right. This, again, we're getting back to the issue of relevance to research ethics, right? So, so now, again, what kind of questions? I mean, you may say, I want to investigate the problems about research during COVID. So, what are some of the research issues during COVID? Maybe you want to, investigate. Well, a lot of people are now doing COVID research. So, what has happened to the other types of research? A lot of people had to stop doing their research projects because they couldn't meet in the lab. Another example is we wanted to do a survey of the public regarding biobanking research, okay? And we were going to have, data collectors sit with the public to fill out the questionnaire. And we had to stop that research. And we developed self-administered questionnaires for investigators. But now we're starting back up with the public questionnaire. So I'm just giving you example. There are issues in conducting research during COVID times. A lot of people had to stop their research. They couldn't meet, blah, blah, blah. So, I mean, I'm not saying, pursue that, but, well, what am I saying? I'm saying, where's your, that's the, where's your protocol? Well, it was about the online learning. I think I can't find it now. So so think about what type of research ethics issue you want to discuss.
Yes.
About the COVID era. Now, the other thing, actually, while we're at it, here's the
I can share it if you'd like to.
No, it's fine. What I'm getting at, okay, this form. In terms of feasible, if you're doing something about COVID, think about this. When are you actually going to start this project? We're going to spend the next 6 months writing out the proposal and then submitting to the IRB. I guess we're all hopeful COVID will be over with in a year. And so the issue is, how feasible is it to do a research project in which a year from now it may not be relevant to COVID? So if like an example, 2 months ago, I started a research project investigating moral distress in nurses caring for COVID patients. Nothing to do with research ethics, a lot to do with medical ethics, which I'm very much interested in. And I knew that I had to do that quickly. So actually, I got some funding within a few weeks. It was focus group discussions on Zoom. I did 13 focus groups, collected the data, analyzed the data, and submitted the manuscript, okay? Because I knew I had to do that quickly. I couldn't take 12 months to do that research project. So you have to think about the relevance, the feasibility, the resources, time to complete. So these are important questions to ask. But the first question is, what is the problem you want to investigate? Okay, this is the process to developing a research problem. So again, Maha, think about again, what problem you want to investigate, and maybe, again, we could maybe, let's go over the other protocols, and let's maybe we could have a brainstorming session, maybe one day this week or next week, okay?
Yeah.
How's that? All right,
Yeah,
good.
it's fine.
All right, good start. Who's next?
I can be.
Who?
Me. Golana.
Golana. Okay, good. Just, oh yeah, here it is. All right, so we want to try to stop by 11 o'clock or 11:15 at the latest. So, all right, this is your protocol. Why don't you quickly tell us? You don't have to. Okay. So, what is the problem you want to investigate?
I want to identify underlying issues related to the composition and the responsibilities and decision-making process of the IRBs, and different attitudes and knowledge and perceptions that PIs, research ethics committee members, chairs, and other researchers have towards the function of the
Golana, could you speak a little louder?
Okay. Can you hear me now? Is it better?
I don't know.
No? Okay. Can you hear me now? Is it better or no?
No, but go ahead. So what is, you're saying a lot of things here. What could you focus the problem you want to investigate?
I want to identify what are the reasons, what are the attitudes chairs and researchers they have towards research ethics committees, because when I speak, people see research ethics committee as different things. They think it's a barrier to their research. Some people think that, some researchers think that we just want to pass it, we just want to code, we just want to start and have it published with the research ethics committee code. It's nonsense, it's time consuming. People there, they don't know really about my subject. So I want to find out what are the issues that they have different perceptions, they have different attitudes toward research ethics committees. Do we need more education on, like, even first year of university in undergrad degree about what is research ethics committee?
Okay.
What do we do?
So why is your target audience research ethics committee members, chairs, and faculty?
Because if we in the committee don't have a consensus of what we are doing in the committee, I cannot expect students and others.
What was your problem that you just stated?
I want to know what attitudes, why they have different attitudes.
Who's
why
they?
they don't.
Who's they?
Members, researchers, PIs, everyone, even the chair.
Everyone.
Yes.
But you were talking about why they have to submit their protocols. It's going to delay research, blah, blah, blah. It sounded more like you wanted to investigate the investigators.
And yes, and the researcher who is the students. master's
Oh,
degree or
okay, the
PhD
students, faculty, but
Yes.
I think, I mean, I didn't get the sense you wanted to investigate members of the ethics committees themselves.
With regards to main two duties of the Research Ethics Committee,
Oh, okay, well then now I'm hearing two different problems.
Okay.
That's all I'm saying is, which is okay, but and there's been a lot of good research asking questions of Research Ethics Committee members and chairs, and a lot of good research investigating the investigators. But what I'm trying to say is that those are two different problems, which is okay. But I would encourage you to be more focused, and you say here variable perceptions towards the RECs, and then members, chairs, PIs, coordinators. You're taking on the world, Golana.
Yes.
You're not Hercules.
Too much.
Yes. All right. So yes, too much. So focus on the problem. Okay. Actually, I mean, decide if you. Well, it seems like. Well, it's two different problems. They're both good problems. Okay. I mean, there was one study investigating Research Ethics Committee members about how their ethics committees function, which yes. I thought was an excellent issue to discuss. Now, you may either do that, focus on the ethics committees, or focus on the investigators. One time we did an interview study of chairs of research ethics committees, asking them about their problems with running an ethics committee. Okay.
So each are separate proposals and separate projects.
Yes, right. Those are separate problems.
Yes.
Okay. So try to understand which problem you want to address. Identify factors forming different attitudes. This is. What do you mean by factors? What are potential factors that could influence, that could be determinant of attitudes?
I want to find out.
How do you find out what factors influence attitudes?
By open discussion, by focus group discussion.
Okay, well, all right, but you say here make questionnaires.
Yes, later, after that, yes.
Okay, yeah. There'll be a social behavioral educational research. I'm not sure what that means.
I thought maybe after the results, we will have educational sessions only for REC members and investigators to educate them.
Excellent idea, but not part of the research proposal.
Okay.
Okay. Again, stay focused. Okay, that's not research. I applaud education, but let's stay focused. All right, focus group discussion. followed by a semi-structured interview. Not comfortable. Well, that's I mean, you could do focus groups and semi-structured interviews, though. Well, again, I'm trying to understand what the problem is. Well, once you I identify better which problem you want. I mean, you could do a questionnaire of attitudes of investigators, or you could do an interview study for sure. Now, what I was getting at, factors forming different attitudes. You know, what I was thinking of is, I mean, you're looking at independent variables forming attitudes. So what could be independent variables? It could be age, faculty status, it could be gender, it could be, what was there? You know, those type of demographic independent factors. It could be perceptions. Perceptions could drive attitudes. Okay. And so again, think about the problem here. But see, you say you want to measure knowledge, perception, attitudes. I mean, that sounds like a questionnaire study, but here now you want to be a social behavioral research, a qualitative exploratory research, but this is more of a concept of a quantitative study.
I cannot understand their knowledge with discussion in the group, how much they know truly about research ethics committee and their function.
Right. I certainly agree with that. But here you say you're going to measure.
Ah, yes, you're right. I cannot. I can know, but I cannot measure. Yes.
Right. Yes. Measure means quantify.
Yes.
All right. So what? Let's be more exact about the research.
I have a question, please, about purpose.
Yes.
Excuse me.
Yes. Yes, you're talking.
I goals and objectives. I can identify objectives versus goals or aim, but what is purpose?
Well, you ask a good question, and you know, maybe maybe we should have a session tomorrow and discuss more. Usually purpose is similar to aims. Well, and you usually have goals. You have the goal. What a goal means, something you want to accomplish by the end of 5 years.
Okay.
The aim is the aim of the research, and the objectives are the specific items you want to achieve in the study itself. Okay. So the purpose is the purpose of the whole protocol, and the objectives are all the different steps you're going to take on to achieve the aim of the protocol. So
yeah, I thought for me it's not clear.
Yeah.
Purpose, goals, like for me.
okay. Well, let's discuss more about that tomorrow. Okay.
Okay.
All right. Good. Next, let's move on. Good questions. Who's next?
Can I be next?
Is that Dua?
Hello?
Yes.
I can.
Dua. Okay. All right. All right. Assessing perceptions, attitudes, practice regarding research misconduct. Okay, among medical students. All right, good. So here's your introduction. So what problem do you want to investigate?
I want to investigate like the prevalence, if there is like high prevalence of misconduct of research among the last year medical students.
Now, what is the problem?
The problem
is not
like,
prevalence.
I want to identify if, I want to identify the perceptions of the students, if they really know what is.
What is the problem you want to investigate?
The problem. I want like to assess and evaluate the perceptions of the students about.
No, that's not the problem. That's the study aim. What?
The problem. Like the problem is the scientific misconduct of research. This is
Okay, good. I'm not asking a trick question here. Okay.
This is the problem, and
Okay.
I want to assess this problem in the UAE.
The problem is research misconduct. Okay.
Yeah.
All right.
This
Right. Nothing more complex than that. Okay.
Okay. The
All
problem.
right. And so now, why do you want to focus on medical students?
Again?
Why do you want to focus on medical students? Why are you
Medical
choosing
students.
medical students?
Because I remember when I used to be in college, there was like, they did not emphasize a lot about research ethics during university.
Okay.
It was
All right.
like,
Good. All right.
it was
good.
like a small one lecture was done for us.
All right, very good. And
So-
medical students need to do research, blah, blah, blah. And
Yeah.
hopefully you could change their attitudes about research misconduct, because changing the attitudes of the senior faculty is hopeless, okay? And we'll fix the problem by focusing on the young people, and blah, blah, blah. So we want to, okay, so medical students, research misconduct, and
So also, I wanted like to, if there's like to evaluate if the what they get in the college, they think it is enough about research ethics, and to see if that's.
why do you want to investigate that for?
Like to see if they get the sufficient learning experience about ethics in the university, or if they think like that.
Okay, well, I guess that's part of attitudes, right?
Yes.
Yeah, okay. All right. So we have perceptions. Again, think about this. What kind of perceptions are we thinking about? Well, let me ask you. Let me ask everyone. You're all very good at writing down perceptions, knowledge, attitudes, practice. Okay, it sounds like you're all singing the same song here. So what's the difference between a perception and an attitude? I mean, you're going to have to write these questions, right? So what's the difference between a perception and an attitude?
So the perception is mainly about the person's beliefs and what they think. Yeah, like perception, how they perceive the thing. Like attitude, he will do something with an action. I will take an attitude, like maybe someone will think that plagiarism is not a bad thing. So this is his perception, that plagiarism is not a it is not a big deal.
Wait. Plagiarism is not a bad thing. Is that a perception or an attitude?
Perception.
Perception?
Yeah, attitude institutes on behavior.
I'm saying plagiarism is not a bad thing. So this way, if I think that, I'm going to plagiarize.
Yeah.
Behavior. So it sounds.
It's an attitude.
Yeah, that's an attitude. So we'll talk more about this later, but all I'm trying to emphasize is that our perception of what a perception is sometimes not very good. So trust me, I've gone through the same learning process. And it's very interesting. We do this research. Why? To change behavior, right? And so think about what drives behaviors. I mean, knowledge, perception. Now, attitude is the most causal link towards behavior. Okay, and you're right. Attitude drives behaviors. So there's perception, but in a lesser way. So for the sake of time, perception is how I see the world. Like, I see the world, there's a lot of plagiarism going on here. That's my perception. My attitude is plagiarism is bad. I'm giving a evaluative component to what I see.
What you see in the board.
Okay. So when we write, almost automatically, we're going to do perceptions and attitudes. We really have to understand what perceptions, attitudes, and practice are. So anyway, having said that, I think it is good to look at perceptions, attitudes, and practice, okay? Now I know your research problem, okay? Your aim is to enhance the conduct. Well, is this proposal actually going to enhance the conduct? Is that proposed? Is this one study going to enhance the conduct of medical research?
No, this is like an aim. I still was not clear with the aim and objectives, but
this is a goal. This is something you want to accomplish 5 years from now, and this is the first step. Okay. So. So the aim of this proposal is not to enhance the conduct, is to, it could
maybe to spot the light on the problem, just like spotting the light on it.
Well, I mean, you want to find out more information about what medical students think about research misconduct, and your objectives, perceptions, attitudes. You left out practice. Investigate the factors. There's that word again, factors. Okay, associated with research misconduct. Factors could be gender, age, rank. It could be factors associated with research misconduct, could be attitudes and perceptions. So
Yes.
you could do an association, investigate the association between perceptions and misconduct and attitudes and misconduct. These are the factors.
Okay.
Buzzwords. We always say factors, but do we actually know what we mean by that? Okay, good. So significant study design. So, what do you, administered validated questionnaire adapted from self-reporting.
I'm not sure, but I just searched about availability of scientific, and I find one called the Scientific Misconduct Questionnaire. It is already validated in the literature. So
validated for what audience?
Yeah, I should revise it and make a pilot, and then I think to pilot the survey to make sure that some students will understand the context before I apply it.
Okay. Would you like to, by any chance, adapt a survey that was used in this research study by any chance?
Yes, I prefer, it is not better than starting from, and to adapt already validated questionnaire is better than, and
okay.
with some revisions in the.
Okay, all right. Well, we could talk more about questionnaire development.
Okay.
All right, very good, good start. All right, so getting back to, keep on, where the, I can never, so it's certainly relevant, it's feasible, not too novel, but that's okay.
But it is not, I did not think still about it. Maybe I'm not sure if I will be in the same project or I will change to different thing.
So change to what?
To a different topic, I'm just putting.
No, this is a good topic. No, I mean, you don't have to score high in every category. Okay.
Yeah.
It's novel probably for the UAE. Okay.
Yeah, it's the UAE.
Right.
They are not.
Resources, time to complete. Okay. I think there's high marks for every one of that. All right, good. Let's finish up. Saeed, you want to talk about yours?
Okay.
The answer is yes.
Yes.
Okay, very good. Good answer. All right. You want to develop a medical student research program?
Yes.
All right.
I will briefly talk about this, and I have another idea that I hope that I have some time to elaborate on. So in this one, in Sohag University and in Faculty of Medicine, we have no units or program to enhance the research abilities of medical students. And to the best of my knowledge, we have no students that engaged in research or published any papers. So my idea is to first to perform a survey for the students to assess their perception and their attitudes toward research. And based on this information, we will develop a medical student research program to give them competences and to engage them in research, and we will study the effectiveness of this educational intervention.
What intervention?
The program itself, the medical student research program.
Okay, so
first,
what is the problem?
The problem is that we have research for medical students is important.
So what's the problem?
Currently, we have no programs to enhance the research abilities of students, and no medical students is engaging in research.
And what do you think that, why is that so?
There are many possibilities. First, that the faculty or the institution doesn't offer any opportunities, either educational or competitive, for students to engage in research. The students themselves may underestimate, or they don't realize the importance of research. So there are many possibilities.
So is the problem with the students or the faculty?
The problem is concerning the students, but the factors related to the students and the faculty.
Okay, so you sounds like you want to concentrate on the students.
Yes.
Okay. All right. That's fine. But in the interest of time, let's stay more focused. I mean, this is very ambitious. You want to do a study, then develop a program, and then evaluate the effectiveness of a training program. This sounds like a 3-year project.
Yeah, so that I have divided them, this project or research, into phases.
Well, I tell you what, why don't you just focus on the first phase, which is this is the research part. This has nothing to do with research, okay? So let's just focus on the research part. This is, I mean, this will take you some time, okay? Yeah. This is a very good problem to focus on, okay? Let's just focus on that. Again, don't take on the world, all right? You're a young guy, you got plenty of time, all right? You don't have to finish this in a year. All right?
Yeah, of course.
Okay,
yeah.
So let's just focus on one thing, you know, this questionnaire study. Now, are you doing the questionnaire or an interview focus group, or are you doing all three? I don't understand that. What do you want to do?
I will do survey to collect quantitative data, and either interview or focus group to gain in-depth knowledge about the students' perception, or some to gain more information that I will not. It will be difficult to obtain from questionnaire only.
All right. Well, I mean, this concept is a mixed methods, but what do you want to start out first? A survey or an interview?
Interview.
Interview? Yeah. You're going to interview medical students?
Yeah.
Well, probably a focus group. You're not asking sensitive questions. All right. Now, an interview study, well, we could talk more about that, but decide whether you want to do a focus group or a survey. Now, you may want to do a literature review and see what's been done.
Yeah.
Okay. Actually, I have some people on ZNAB is involved with a study about undergrads and research ethics. Not so much research, but anyway. So think about that. Do see what's been done. Literature review is also an important step in the research process, right? You want to know what's been done before, right?
Yeah, of course.
All right, good. So this is a good start. I think it's relevant, feasible, yeah, novel resources, time to complete. You have to focus on that, you know, and then think about survey or questionnaire. All right, let's finish up. Really, Saucer, why don't we finish up with yours before we take a break? All right,
okay.
What's your problem?
Okay, my problem is I don't have a research ethics committee in my college. And that's pose a lot of problems for my department specifically, because we are in the genetic department. We study different research studies about a lot of things, like about a lot of organisms, and some of the studies actually do extreme violation of research, and from both types, like the academic one and the other types, like the trials and using human subjects and stuff like that. So I felt that we really need to have a research ethics committee that started in our college, and it when I focused on that, actually it helped me when you give us the first survey, the IDP survey in the beginning, when you ask us for 2 surveys. There is a lot of things I didn't know about the policies and stuff like that. So I thought that maybe if I put my effort in this, I can, manage that. In the beginning, I had actually 2 or 3 ideas, and it kept popping up. And I thought that to put all of them together, but I felt it's going to be really too much for only having focused point of view for one proposal. But when I had the session with you and Dr. Maha about the social and behavioral research, I actually started working on another proposal too for that, because there is a lot of issues here that intriguing. I know it's not intriguing me as, like a colleague in a practical college or something like that, but it's intriguing as a community work for, like the community and the custom we are in here in Egypt. So anyhow, so the point is, I have 2 goals. I noticed that everybody in their projects or proposal wrote an introduction. I wrote one, but I felt it's really weak because I really wanted to go to the point.
What specific problem do you want to investigate?
The specific problem is divided to 2 things. Is the first, raise awareness of the importance of establishing research ethics committee, because some people in my university, like the senior ones, doesn't take this seriously, and actually the youngest one doesn't understand what the meaning of it. So I thought raising it, and in the same time using my method to establish, like do both, like hit a rock, hit a bird with 2
rocks. I mean, I agree. This is your goal, but see, these objectives here, they're not research objectives. It's more like an educational session, like to be familiar. That's not a research of, I mean, what's the objective of your study? And better yet, I mean, your problem is people, well, you don't know why there isn't an ethics committee in your department, so you want to start exploring why people may not think it's important.
Yes.
Right,
Totally.
and so so you have to, well, you say here, all faculty members.
Yeah, but I meant, I said the focus group was going to be on the one that are uneducated or
Okay, you say
uninformed.
quantitative study.
Yeah, I'm sorry.
Well, I mean,
Yes,
you know, think about
yeah.
it. Think about it if you want to do a quantitative.
Yes. I had something about that to say.
Yeah.
I know that, that there is a lot. Okay. Because some of us, like I am one of the people that teach research ethics in my university, and we had actually like multiple workshops teaching our senior professors about that, but we had a lot of resistance. So that's why I said when we have the focus group, we should focus on the people that like the professors or the faculty member that are really not aware.
How feasible will it be for you to do focus group on senior faculty?
What do you mean? What do you mean by that?
Well, are they going to sit down and talk with you?
Yes, totally. Because we actually I can use our departmental meetings or our seminars or the way that we have to be gathered together in a place for a meeting or a conference or something in the university or the college, and we can start doing that, and I can then try to what do you call it? Try to attract their attention to what I'm saying and show them how this is important for them and for their students.
All right. Make sure be prepared to do a focus group over dinner.
Yeah, I thought about that. So actually, I suggested that in our seminars because nobody was attending the seminar. So yeah.
All right. So why don't you rewrite this proposal, make it more focused? Focus group is fine. We'll talk more about the objectives. One last point, okay?
Yeah.
Do me a favor. Don't state that faculty members are uneducated.
I'm sorry, I meant about the research ethics.
Well, no, I'm talking about the word uneducated. You don't want to call faculty members or medical students or anybody uneducated. All I'm trying to say is that's not a very nice word to use. Okay. Oh, not knowledgeable, blah, blah, blah. All I'm trying to say, this is the English language. I'm sure you have a better word in Arabic, but uneducated is not a nice word. That's all I'm trying to say. So anyway, you have a great problem, okay, to investigate. It's very relevant. Focus group, I think it's feasible, though it may be difficult to, I think we lost Sawson, huh? Yep. I could tell when you guys are ready to leave, because all I see is a static
I'm
face.
sorry. I'm sorry.
Yes,
What did you guys say? I'm sorry. I disconnected the minute that you said uneducated.
Right, okay. All right, so
I need to hear what you said.
It's relevant. Well, uneducated is, all I'm trying to say, it's not a nice word to use. That's all, okay?
Yeah, I'm sorry.
No, that's okay. And
I just needed to ask a very, very important question to me, actually. So I totally understand when Dr. Rahab was speaking about the qualitative and quantitative and the way that we use algorithm for classification of the clinical research. I totally understand everything. I needed to know that my seminar is gonna follow by the online survey. I'm gonna walk them through it and everything, so I know that it's absolutely quantitative. But the thing I had trouble with, I know it's observational and descriptive too. The problem is I didn't write the introduction and I didn't put resources, but I saw all your research papers online for the attitude and the perception and the knowledge, and some of the research, other research too, was made here in the Middle East, and in the book that you had, you know, like you're the editor in the book of the Middle East region, you guys were using a cross-sectional study in questionnaires and in surveys, and I didn't understand what is the difference between what I'm using and what you're using.
Because what are you using?
Well, I took the chart, you know, like the chart that Dr. Rahab presented in her lecture. It's like, you know, you're investigating, so it's observational. Do you have comparison groups? No, I don't. So it's descriptive, and I ended there. But when you have comparison group, you say yes, so it's analytical group, so you have the direction of cross-sectional or case control or cohort study. So I felt really lost in this, and I didn't go further to say how I'm gonna analyze the data. I am gonna have the open answer. What do you call it? Long answer or?
I mean, none of these studies that we've been talking about are cohort or control studies. Okay.
Mm-hmm. Yeah.
I mean, it's more social behavioral.
Okay.
We're not investigating an exposure.
Yes.
Or an experimental drug.
Yeah.
So, I mean, it's cross-sectional. We're investigating at one period in time a whole area.
Yeah. So, actually, I thought that 1 to 2 years are reasonable for trying to raise awareness and in the same time establish the research ethics. And I really needed to ask you if I have to rewrite my objectives. Can you give me an example?
None of these. Look. Start with understanding what's your aim of your proposal. What do you want to accomplish with your research proposal? And then, what are the steps? What are the objectives? Okay? I mean, none of these objectives, to reckon, again, this sounds like a course in research ethics. We'll talk more about objectives tomorrow, but none of these, to understand the operations, is that the objective of the proposal?
No, I think actually this was the objectives to me, to understand all that so I can transfer it or disseminate it to the people that I'm going to try to convince them to issue.
All right, good.
You're right, yeah.
All right, totally. That's fine. So, okay, let's take a break. This has been a very good session on understanding more about the research process. So I think let's talk more tomorrow about the research process over the Eid holiday. I know it's a holiday, but why don't, during that time, why don't you find some time to redevelop your proposals, focus more, and so that we have something to talk about when we meet again next week. Okay, so actually, take this holiday. I'm not trying to. Well, I guess I am trying to say do some work over your holiday. I apologize, but I think it's well worth the effort. Okay.
Yeah, I'm sorry. Just one thing. I had something nobody else had, and I felt that I'm thinking negatively, but about the limitation. Did you see the limitation of my proposal? With this, did you feel that it's realistic limitation and the you know, like how I can overcome it? Do you see it's realistic or it's not? I'm sorry.
Oh, that's something you have to ask. Feasible. I mean, will you be able to get it done?
Yeah. Okay.
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 I mean,
okay.
well, that's why I asked you, will the senior faculty sit down with you? You said yes. Okay,
yes.
fine. If
okay.
you believe that, that's fine. That's
I'll think about the dinner too. Yeah. Okay.
Okay. All right, good.
Thank you.
Let's take a break. All right. All right, good. See you in about 30 minutes, if that's okay.
Okay, bye-bye.
Okay, thank you.
All right, good.
Thank you.
Bye.